October is Breast Cancer Awareness Month, and we are visiting with Dr. Ben Smith with Essentia Health. How are you doing today?
I'm well, thank you.
Good, good. Of course, Breast Cancer Awareness Month how prevalent is breast cancer? Do you see a lot of it?
We do, unfortunately. Breast cancer affects about 1 in 8 women in a lifetime. So most people have a family member or know somebody who's been affected by breast cancer. It's unfortunately very common.
Is that something that you see a little more often now than used to? And if so, what do you think possibly could be the cause of something like that?
So we certainly do detect more breast cancer now than we once did. I think that's largely related to the technology advancements that have been made with screening with our mammography units. We know that the rate has increased some compared to 30 years ago, let's say. I think largely related to our ability to screen women now very well and detect cancer very early with the equipment we have.
Why is early detection so important? What kind of a difference does that make that you discover breast cancer early?
So early detection is significant in that when we find cancer early, we're very easily able to treat that cancer. If we can identify breast cancer that's confined to the breast, there is a 99% 5-year survival. That's kind of what cancer statistics are measured in. You know, how many people after 5 years are alive or didn't succumb to their cancer. Like I said, 99% if we can identify breast cancer confined to the breast is about as good as it gets in cancer. So that's why early detection is really important, so we can detect those cancers before they spread elsewhere in the body, where then the 5-year survival tends to drop.
When should we start getting mammograms?
So we recommend that people begin getting mammograms at age 40. And then every year after that. That's for average risk women. There's unfortunately been some studies published which are based on kind of a very large antiquated study out of Canada, which kind of muddied the screening guidelines. It used to be that we recommended annual mammograms globally starting at age 40 and then every year after for average risk women. Now there's some varying recommendations related to that big study that came out of Canada, which unfortunately was poorly done and antiquated and shouldn't really have been considered in our guidelines today. We know for a fact that starting at age 40 and screening every year thereafter saves the most lives from breast cancer.
I know that some women are concerned of the radiation that comes with the screening. Is that a concern? Should it be a concern?
So that's a common question I get, and it should not be a concern. When we live on Earth, just living on Earth, we're exposed to cosmic radiation, radiation from the sun, radiation from radon gas. The radiation you receive from a mammogram is equivalent to about 7 weeks of life on Earth. The benefit of detecting a cancer far outweighs that radiation risk.
Let's cover the types of mammograms, because I know that you also have it's like a 3D one, right? Because I get that one, and I like that.
Yeah. So we do conventional 2-dimensional mammogram and a 3D mammogram. The 3D mammogram is, in my opinion, the better mammogram, but any mammogram is better than none. The 3D mammogram actually takes 1 millimeter images through the breast, kind of like we slice the breast like a loaf of bread in 1 millimeter increments, and we look through the breast in those 1 millimeters rather than just having a single picture, which we do in a 2D mammogram.
Which larger, denser breasts, you know, that works better for that, and so you're better to find problems earlier in that type of situation. And probably the last question I have, and one of the most common ones you guys get, is, does it hurt? I'll tell you from experience, you know, it's a little uncomfortable, but it doesn't hurt. And the ladies are really good about stopping, you know, we good here, and I think that's really important.
Yeah, I think that most people that come in are apprehensive, and rightfully so. But after leaving, I think they say exactly what you did. You know, it's a little uncomfortable, but because the exam's so short, you know, it really is inconsequential. in relation to detecting that breast cancer early.
Okay, sounds good. October Breast Cancer Awareness Month. We've been visiting with Dr. Ben Smith with Essentia Health. So give Essentia Health a call if you would like to set an appointment for a mammogram and get that taken care of. Thanks so much, Doctor.
Thank you.